Chairman recognizes the gentlelady from Michigan, Mrs. Dingell.
Thank you, Mr. Chairman. I strike the last word, but I need help doing my math. So I want to build on what my colleague from California and New Mexico were asking. My colleague from Michigan, who I love and is one of my dearest friends, but I don't understand his math. Earlier today, he said that this was that this bill was okay because it didn't jeopardize the success we've seen of the Healthy Michigan plan, and that it wasn't going to hurt it. But the way that I understand it, it puts an arbitrary date to ending expansion of 690, I'm so tired like the rest of you, 695,000 people right now have coverage. But bam, 219, anybody that comes after that's not going to be covered. But by the way, you've got to back.
No, if the gentlelady will be healed, they're not going to be covered. No, but don't say that they're not going to be covered because they will be covered.
The gentlelady from Michigan.
They will be covered.
Right.
But anybody that comes after that's not going to be. But then we've
no.
also got. Okay, well, let me finish my math.
Gentlelady will yield. They'll still be covered, but they'll be covered under a lower FMAP.
Okay, they'll be covered under lower FMAP. But I'm going to now build on what Anna was also talking about, because Medicaid is the largest payer of long-term care in this country, accounting for 42% of all spending. And as our population starts to age, which is going to happen, the demand for long-term care is going to double in the next 40 years. Among people 65 and over, it's estimated that 70% will need care at some point. And people who are older than 85 are 4 times more likely to need these services than younger services. So all this math is coming together. And yet you're telling me, no, we're not going to have to ration. No, we're not going to have to worry. And I can't get the math to add up in my head. And maybe it's because it's 4:30 in the morning. But I don't think it is.
Sorry, I had about 3 people talking to me at the same time. Does the council want to, if the gentlelady, does the council want to yield to the question that she was asking?
I don't care. I love my colleague, but I just can't figure out his math tonight, right now.
I thought you loved another former member of this committee from Michigan.
He's my love, true love.
I just wanted to set the record straight on that.
That's a good clarification.
All right.
He's probably asleep and not watching this either.
He's got sense. He's asleep.
He's probably on tweeting.
He's the one.
Who's worse?
Somebody else.
We need humor. We need it. Okay, could someone help me with my math? I'm putting my staff's getting mad, so I'm putting my.
Sure, Mrs. Dingell. So I think you had a question regarding how the Medicaid freeze would work and how it would affect expansion states.
And how are we taking into account all this math, that we're going to freeze the number, we're going to have more people, we say we want people to be able to come into Healthy Michigan, and then we've got all these seniors that are going to be needing more care. They weren't on Medicare because they had private insurance beforehand. Suddenly they need Medicaid to help.
Keep going.
So the bill before us would allow expansion states to continue to enroll individuals on expansion until January 1st, 2020. At that date, those individuals who stay on the Medicaid program, the state would continue to receive the enhanced match as long as those individuals.
But just for the old ones, not the new ones.
Correct. So for individuals enrolled after that date.
So that ends expansion then.
The state could continue to add enrollees at regular match.
Okay, now what are we doing about these seniors whose numbers are growing and have to go into that number somehow? And we're not going to hurt them. We're not going to ration care.
So the aged are a traditional Medicaid population. Not
we're growing. We're doubling. 10,000 of us are turning 6. I'm not 65 yet either, for the record. Fred's older than me. But
I'm not 65 either.
I know.
So, Mrs. Dingell, I think that was a reference to how a growth in seniors in a state would intersect with the per capita allotment. So,
and greater health care needs as well.
To the extent that more individuals enroll in the Medicaid program in any state for any category, the federal contribution to the state would increase under the per capita allotment.
But is it going to keep up with inflation, with the cost of long-term care, especially when you hit 80 and over? How do they account for, that's the population that has the greatest health care needs. How are we accounting for the increase in those that need coverage?
I might ask the gentlelady might have an additional 25 seconds.
Oh, my
Unanimous
Lord.
consent.
With
By
that,
the time you figure
Thank
that
you.
machine
Without
out, will be
objection.
30.
25 seconds.
So the per capita allotment provision would grow at CPI medical.
Minus
Not with the
35.
real
Medical
rate of
inflation.
inflation. Thank you.
45.
And thank you for my extra 25
Gentlelady's
seconds.
time